Imagine a routine checkup at your GP. You feel fine, but a new blood test is added to your usual screening. A week later, you get a call. The test has picked up a faint signal, an early-stage cancer, long before any symptoms appear. Because it's caught so early, a simple procedure is all it takes to treat it. This isn't science fiction. It's the future scientists are racing to create. For decades, cancer care has been reactive, waiting for symptoms, then fighting an uphill battle. Now the goal is to find cancer before it makes us sick, flipping the script on how we approach the disease. Early detection offers hope and control, transforming anxiety into reassurance. No test is perfect, but adding this early warning system could revolutionize healthcare. Cancer could become a manageable condition, like high blood pressure or diabetes. This vision drives the development of multi-cancer early detection, MCED tests, simple blood tests that can screen for many cancers at once. Sometimes called liquid biopsies, they analyze your blood for clues, much like a traditional biopsy analyzes tissue. The ambition reshape preventive medicine and save lives with a single accessible test. Why is early cancer detection so hard? Because cancer starts as a handful of rogue cells, growing silently for years. By the time symptoms appear, the disease may already be advanced and harder to treat. Current screenings, like mammograms or colonoscopies, are valuable but limited to specific cancers. Most deadly cancers, like pancreatic or ovarian, have no routine screening and few early symptoms. Millions remain vulnerable, even if they follow all recommended tests. The challenge: find a universal signal for many cancers long before a tumor is visible or causes symptoms. Thanks to advances in genetics, scientists are now searching for these signals in the bloodstream. Enter the multi-cancer early detection test, or liquid biopsy. It's a simple blood test that looks for molecular signs of many cancers at once. Instead of waiting for a tumor to show up on a scan, it searches for tiny clues shed by tumors into the blood. Unlike invasive tissue biopsies, a liquid biopsy is quick, safe, and can be repeated regularly. These tests cast a wide net, screening for dozens of cancers, including those with no current screening options. A positive result doesn't mean you have cancer, but it's a crucial early warning. The test can even suggest where in the body the cancer signal is coming from, guiding doctors to the right follow-up. It's the first step in a new, proactive approach to diagnosis. This technology could change how we find and fight cancer. The future of screening is in the blood. So, what are these tests looking for? All cells, including cancer cells, release fragments of DNA into the blood. MCED tests analyze this cell-free DNA, searching for cancer-specific fragments called circulating tumor DNA, ctDNA. Cancer DNA carries unique mutations and epigenetic changes, molecular fingerprints that set it apart from healthy DNA. Advanced sequencing and AI sift through millions of DNA fragments to find these rare cancer signals. The technology is so sensitive, it can detect a whisper of cancer DNA among millions of healthy ones. Some tests can even predict where the cancer started, thanks to tissue-specific DNA signatures. If the test finds ctDNA with a lung signature, doctors know where to look. This precision makes follow-up faster and more targeted. It's a monumental leap in early detection. The science is complex, but the principle is simple. Find cancer's fingerprints before it leaves a trace. Standard blood tests check for things like cholesterol or blood sugar, substances normally present in the blood. MCED tests are different. They hunt for tiny abnormal fragments of cancer DNA that shouldn't be there at all. Detecting these rare signals requires next-generation sequencing and powerful AI to analyze massive amounts of data. These tests are far more complex than routine blood work and are currently run only in specialized labs. Years of research and billions in investment have made this possible. It's a leap from simple chemical tests to deep genetic analysis. The result: A new era of blood-based cancer screening. This is not your average blood test, it's a technological marvel. The benefits of MCED tests could be transformative. Early detection means simpler, more effective treatment, and better survival rates. Many early-stage cancers can be cured with surgery or localized therapy. Screening for multiple cancers at once makes health monitoring more convenient and accessible. It could increase screening rates, especially for cancers with no current tests. MCED tests may reduce the need for invasive, costly procedures by guiding doctors to the right place from the start. The diagnostic journey becomes faster, less stressful, and more efficient. Widespread use could turn cancer from a crisis into a manageable condition. Catching disease early means less toxic treatment and better quality of life. The hope: a future where cancer is found early, treated effectively, and feared less. Despite the promise, MCED tests face real challenges. False positives can cause anxiety and lead to unnecessary, risky follow-up tests. False negatives may give false reassurance, missing cancers that are present. Not all cancers shed enough DNA to be detected, especially in early stages. These tests can't replace standard screenings like mammograms or colonoscopies. Some cancers are easier to detect than others. Brain tumors, for example, are harder to find in blood. Even a positive result requires traditional imaging and biopsies to confirm and locate the cancer. Overdiagnosis is another concern, finding slow-growing cancers that might never cause harm. As the technology evolves, doctors must learn to balance early detection with avoiding unnecessary treatment. MCED tests aren't yet for everyone. Large clinical trials are still underway. Right now, they're mainly studied in older adults and people at higher risk, those with a strong family history or genetic mutations. For these groups, the benefits may outweigh the risks. Most people who get the test do so as part of a research study, helping scientists refine the technology. If you're considering an MCED test, talk to your doctor or a genetic counselor first. Understand the risks, benefits, and what the results could mean for you. This is a powerful tool, but it's not a decision to make lightly. The journey of MCED tests is just beginning, with rapid advances and ongoing challenges. AI and big data are making these tests more accurate every year. Massive trials, like the NHS Gallery study, will show if they truly save lives and are cost-effective. Until then, experts urge caution. Don't skip proven screenings or healthy habits. Stay engaged with your health. Attend recommended screenings, report symptoms, and live a healthy lifestyle. The future of cancer screening is bright, but we must balance hope with evidence. These blood tests could change millions of lives, turning fear into foresight. We're on the cusp of a new era in medicine, one worth watching with hope and care.